Good morning. My name is Ashley Craiglow. My pronouns are she, her. For a physical description, I am a female with dark brown shoulder length hair and glasses, and I'm wearing a khaki colored shirt. And I'd like to welcome and thank you for joining us for today's session on Housing 101, the Continuum of Options for Older Adults. Before we start, a few housekeeping items. We are excited to announce that today's webinar will be accessible to a wider audience. We have arranged for sign language interpreters who will be present throughout the session. These interpreters will rotate every 20 minutes, ensuring that everyone can follow the content effectively. If you do need those interpretations, you will just want to click the interpretation button on the bottom of your screen and go ahead and select the ASL. If you have any issues finding that, please feel free to reach out in the chat and I can assist you. Additionally, we are recording the entire webinar with ASL interpretation, and the recordings will be available on our YouTube channel for later viewing. Whether you attend the live session or catch up later, you will have the opportunity to engage with the material in a way that suits your needs. I also encourage you to subscribe to our YouTube channel so that you can keep up with the latest additions to our video library. We are also looking for suggestions for future webinar topics. If you have suggestions for topics or speakers, feel free to send those to me at my email, which I will share in the chat. If you can please keep your microphone set to mute, and just note that if you're experiencing any issues with bandwidth or audio quality, it often helps to disable your camera. Enter your first name and organization and the community that you're from in the chat box, and what you're hoping to get out of today's session and how you found out about us. If you have any questions during today's session, please feel free to enter your question into the chat and we'll address those at the end of the presentation if we have time. If we do not, we will make sure that we get those answers to the questions sent out in an email following up. At the close of today's session, you will see a quick evaluation of today's session pop up in your browser. So if you can please take a moment and complete that survey, it greatly helps us when planning future sessions. And one last quick reminder is to visit our Facebook page for more information about other upcoming sessions. And we have our next sessions listed at the bottom of our slides here today. So I'm going to take a moment to read our Arrowhead Area Agency on Aging land acknowledgement. So as we support our mission to help older adults maintain their highest level of independence, we do this while being respectful of the space we are being welcomed into by Indigenous people. We strive to deepen our understanding of the multiple ways in which people see and understand land and acknowledge the Indigenous people who have relationships in this land. We also acknowledge the decades of historical trauma, loss, and grief experienced by Indigenous people. It is our promise to not only recognize these truths, but to also take action to show support of our Indigenous elders, neighbors, and friends, and understand our place within the past, present, and future of this land. We know this is just one step in recognizing and honoring the sovereignty of tribal nations. So I am honored to be joined today by today's presenters, Marjorie and Brenda, and turn things over to them.
All right.
Thank you.
Marjorie, do you want to introduce yourself?
Sure. I'm Marjorie Bottala. I'm the Contact Center Manager for the direct support side here at the Area Agency on Aging. And by direct support, I'm referring to the statewide senior linkage line. I've got short brown hair, even shorter as of today, with some salty parts, and I wear glasses.
And my name is Brenda Schaefer-Pellenin. I am part of our development team here at the Arrowhead Area Agency on Aging. I'm a she, her pronoun, and I am a petite middle-aged woman with really short hair, and much shorter and now blonder than it was in the picture, and wearing a pale pink sweater today. Next slide.
And I'm just going to go ahead and take over. Also, I'm she, her pronouns as well. So move to the next slide, please. So we're going to talk a little bit about who we are, but first we're going to just show you a map of how we cover the all 87 counties of the Arrowhead region, or of the state rather. We're in the Arrowhead, so the dark blue, but we've got also a Minnesota Indian Agency on Aging, and where that differs is that it doesn't have a live contact center, but the other 6 of the 7 do. So there are 7 agencies on aging. 6 of those have live contact center staff. And again, the whole 87 counties of Minnesota are supported and covered this way. Next slide. So the Arrowhead Regional Development Commission and the Arrowhead Area Agency on Aging are the designated Minnesota Board on Aging and Area Agency on Aging Planning and Service Area, so the PSA, under the authority of the Title III of the Older Americans Act. I mentioned that we have 7 AAAs. 6 of those are the ones with the live support. Our area covers the 7 counties of the Arrowhead, so Aiken, Carlton, Cook, Itasca, Coochin Lake, and St. Louis counties. But as mentioned earlier, all 87 counties are covered under the Older Americans Act, and our Arrowhead Area Agency on Aging is committed to helping older adults maintain the highest level of independence through different programs and supports, either by our agency or by funded and supported Title III grantee agencies. Next slide. Core functions of the agencies on aging are funneling the Older Americans Act dollars that are received annually to those grantees and support agencies in our region. So things like legal aid services, Meals on Wheels, congregate dining sites, chore services, caregiver supports. The second area that we do is the service and development, which is collaborating in and among our communities in our 7 counties to help build capacity for some of these services that meet the needs of an aging population, um, through coordination and development, and again some other things, but mostly just working with these agencies and agency support providers to build a better service area and support for, again, an aging Arrowhead, along with that caregiver and family support. Then the third area of our function is the information assistance, which is delivered through the senior linkage line. So information assistance, counseling, referral, the long-term care options counseling, and the Medicare supports, caregiver supports, building community support plans to help people return to the community from nursing facility stays and remain in the community. Next slide. Our objectives today are to go through the range of options for housing and how we might pay for some of those housing options, planning ahead, and then we'll go into resources and hopefully have time to field a lot of your questions here at the end. We will provide all of the resources and the PowerPoint slide to you, along with any links that we mention or refer to today. Next slide. So first we're going to kind of talk about the changing demographics that we see here in Minnesota, and we're going to move to the next slide. And just overview that 1 in 4 people in our 7-county Arrowhead region are over age 65, so 65 plus. We have some of the Minnesota's oldest residents in one of our counties, actually, but it's actually changing throughout. We have people who are 85 and above, and that is expected to double in the next 35 years from 120,000 people to 270,000. So again, being innovative and trying to figure out how we're going to support folks as they age in our region and of course statewide is going to be the challenge and an opportunity for us to come up with different and, like I said, more innovative ways to do that. The number of Minnesotans turning 65 in this decade is about 285,000, and that's greater than the past 4 decades combined. our boomer generation is kind of unlike any other. It's pretty large. So we as a nation, but especially here in Minnesota, have not experienced something like this. So again, it's going to require some creative thinking and collaboration. Next slide, please. So this just shows the difference between 2015 and what we will expect our counties to look like as far as percentages of those 65 plus in 2030. Again, I mentioned we have kind of the oldest county in our region, which is Aiken. So maybe small population, but still the oldest county per capita in the state. We don't see that changing anytime soon. This information is found at faceagingmin.org. So that's something, again, that we will share with you if you want to look at more demographics and more information about the aging population and how things are changing and what we need to do or look at to be able to respond to that. Yeah, so again, more details at faceagingmin.org. Next slide. So there's a myth out there that people end up in the nursing home as they age. That isn't true, although in a slide way down the road here, we are going to talk about most people needing some sort of long-term care, but mostly it's short-term. So it, belies the words long-term. But yeah, we have about 48 million people over age 65 in the US, and 84% live in their own homes and are not receiving any supports, formal supports, or care services to remain in their own home. Less than 14% of the older adults receive support through the Aging Network, which is us, to stay in their home, and then less than 5% of those are living in skilled facilities, nursing homes, and other long-term care settings. And then I'm going to hand off to Brenda.
All right, thanks, Marjorie. So where you live depends upon a lot of things, but most importantly, it depends on you. As you age, you can choose to have needed services brought into your home, including home care services, or you can choose to make a move. If you choose to move, it is a big decision that can be really overwhelming. And there are a wide variety of housing options, including independent living, assisted living, skilled nursing facility. And the staff at the Senior Linkage Line can help you to compare those options so you can make the best choice that fits your needs. Next. So how do we provide care in the community? And I think it's really important as we get into this to recognize that this is not, when we talk about a continuum, this is not a linear continuum. It's not simply traveling in one direction. An older adult could be discharged from a skilled nursing facility back to their home after receiving, say, rehab services and setting up supports at home. And the Area Agency on Aging, we frequently, programs that we work with are frequently provided in the home by local nonprofit providers. And programs like the Area Agency on Aging, the Information Assistance Program, Senior Linkage Line, and other related programs can help folks with transitions from one setting to another. So next. So one option might be, like Marjorie said, there's that large group of people who are really living at home without support. And the majority of older adults really do live in their homes without any outside supports. But an awareness of the available services that those can be critical in planning your future and allowing you to add services as needed rather than we often end up talking with somebody when it's a crisis situation, an emergent situation. And being in that sort of a situation can make you feel like your options are limited. Next. Our next option is home with informal supports. And some older adults have informal caregivers in their lives. And many of these people, individuals, friends, or family of choice, who are providing these informal supports may not identify as caregivers. And they may see simply the ways that they are helping their friend or family member. This caregiving might be things like picking up groceries or medications, maybe giving someone a ride to the doctor, helping with laundry or shoveling the walkway, helping to pay bills. Today, we are all caregivers, as both men and women of all ages and cultural backgrounds and professions are starting to take on this role. Next. And I want to take a moment just to talk about a little bit about the value of those family supports, because, it's valuable to the individual, but the amount of cost savings to us as a society of a family caregiver, whether that's a friend or a partner, a neighbor, who's providing to assistance for folks. Just looking back at some of the more recent data, Minnesota caregivers in 2017 provided 540 million hours of care at a value of $8,600,000,000. And in the United States, family caregiving is worth about 470 billion yearly, more than all of the out-of-pocket spending on healthcare in 2017. So really a very impactful and often unrecognized and maybe not always valued or honored, but definitely really important. Next slide, please. So home sharing can be an option. Home sharing is an alternative for people to meet their housing needs and provides numerous benefits to homeowners and renters alike. This can be a shared arrangement that might involve a homeowner or a renter sharing space, and it might just be that there's shared rent, or it could be that you are maybe somebody is providing some sort of assistance. Maybe it's shoveling, maybe it's getting the groceries to cover part of that rent. And really, no two home sharing situations are alike. Each really needs to be tailored to the needs and desires of the people involved. Next slide, please. So our next option is where a lot of folks are, is at home with the a la carte community service menu. And so that might be you're living in your home and maybe you are getting assistance with assistive technology, maybe you're getting home modifications, you might be getting home delivered meals, something like Meals on Wheels, or visiting and going to a congregate dining sites, maybe in the community. You might be getting some transportation services to appointments and things like that. And services in the community can be private pay, free, or offered on a sliding scale. Many organizations in our region offer multiple services to older adults in the community. And staff from these organizations typically do an intake assessment to look at someone's risk factors and help determine what services might benefit a client. Next slide. Another option is home with in-home care. This is services provided by a home health care agency or a hospice registered nurse, a home health aide, or a homemaker. These type of services can include assistive tasks by unlicensed personnel, services provided by a registered nurse or a licensed practical nurse, physical therapist, respiratory therapist, occupational therapist, and so forth, or social worker. It can also be the receiving durable medical equipment with any of those services as well. Next slide. Another option that you probably see out in the community, we often see on community bulletin boards and things like that, folks looking for someone to work as a personal care assistant. A personal care assistant provides services to someone who needs some assistance with activities of daily living, instrumental activities of daily living, and health-related functions. Someone can get PCA services, either the traditional route, which is through a PCA agency, where that agency finds a homemaker, the PCA or homemaker staff for the client. We also have the option of PCA choice, which is where a client comes to an agency with someone, might be a friend, a family member, a neighbor who is willing to help, and they'd like to hire them on. And so that can be friends or family. And then staff complete an application as well as some testing and a background check, and then that person can begin working for that individual. And those activities could be things like those activities of daily living, eating, toileting, grooming, dressing, bathing, transferring, mobility, and positioning. It can also be, like I said, health-related functions. It could also include things like meal planning and preparation, managing finances, helping someone shopping for essential items, doing chores around the home, assisting with communication, etc. Next slide. Next slide, please. All right. Another, oh, back up. Another option is home with self-directed services. So that's an option for folks who are eligible seniors who are at risk of assisted living or nursing home placement who want to remain in their home. And it allows them to be able to purchase and direct their own services by hiring and training workers that they know and trust, such as family, friends, and neighbors. And there are options for accessing some grant dollars and things like that to help stretch those individual out-of-pocket funds towards the cost of those services. Next slide, please. So just some of examples of people who are actually doing these things out in the community. So Edwin and Clara are a couple in their early 90s who live in the rural Aiken area. Their son picks up frozen and receives frozen meals for them at a local agency. They also get rides to their clinic appointments from a volunteer driver program. Herbert is a man in his late 70s who lives in Duluth. He has a PCA who comes each morning to help him assist with dressing and preparing a morning meal. He also gets homemaker services, which help him with laundry and light cleaning. And he also gets a friendly visitor who stops by twice a week to visit and to play cards. Myrtle is a woman in her early 80s who lives in Virginia. She lives alone. She has some mobility issues. Myrtle has a daughter who lives an hour away and visits frequently. Myrtle also, she gets grocery delivery services. She gets Meals on Wheels. She also gets rides through her local transit provider to visit with her friends at her local senior center. And lastly, John and Gary are a couple in their early 80s who live in Grand Rapids. John is the primary caregiver for Gary, who is diagnosed with dementia. Gary attends adult day services several days per week, and John and Gary are part of a dementia support group for caregivers and care recipients. Next slide. So other options that we have out in the community are things like respite care. And respite care can be as simple as a few hours a week, or it could be an extended period. But utilizing respite services can really help a caregiver get relieve stress, help them recharge, allow them to catch up on errands outside the home, allow them to attend to their own needs, medical needs, just going and getting a haircut, going to a movie, really just being able to step out of the caregiver role for a little bit and take care of themselves. And respite care can be really helpful for someone that you're caring for and provide a pleasant change to their routine as well. Next slide. So internal, attached, and detached accessory dwelling units, and you may have heard some very unflattering names for them like granny flats and things like that. But those can be have the potential to increase housing affordability both for homeowners and for tenants. They can create a wider range of housing options within a community. They can allow the older adult to stay in your family as they age and facilitate better the use of existing housing fabric in established neighborhoods. Many cities and counties have signaled support for these accessory dwelling units in their plans and are starting to adopt zoning regulations that permit accessory dwelling units in residential areas. And we do have in our video archive with the Area Agency on Aging, we do have another webinar that we've done on accessory dwelling units. So if it's something that you're interested in, I can also direct you to, if you want to get in touch with me, I can also direct you to a lot of really great resources from AARP on accessory dwelling units. Each individual community has different regulations in terms of whether or not and what the placement of accessory dwelling units are. And so it really is individual to each community whether or not they allow them. But it's also a good thing to bring up when your community is starting to look at their regulations and making sure that we are allowing for some thinking outside the box and for being innovative and not limiting our options. Next slide. So another option is senior apartments and congregate housing. And those types of housing, we've got subsidized housing, or affordable housing, which are for those individuals who are low income. These can be publicly subsidized or privately subsidized. We also have market rate apartments. These are just your general apartments. They are not receiving any sort of assistance or support and it will charge whatever the market will bear. Another option is cooperatives or condominiums, where you have ownership and are responsible for upkeep, and you may also pay some monthly fees for the management of the building and to the common spaces. Next slide. Another option is assisted living. Assisted living means a facility that provides sleeping accommodations and assisted living services to one or more adults. Assisted living facilities may also include dementia care. And we'll get a little bit more into that. Next slide. So assisted living services can include one or more of the following: assisting with dressing, self-feeding, oral hygiene, hair care, grooming, toileting, bathing. And we'll provide you with these slides so you've got the reference. But obviously, so it provides a lot of those individualized assistance that someone might need. Next slide. Again, that's just a continuation of some of those items. So next slide. So in the past, we did not have a licensure structure. We do now in the last few years in Minnesota have a licensure structure. They can be licensed either as an assisted living facility or an assisted living facility with a dementia care license. With a dementia care license, that means ongoing care for behavioral and psychological symptoms of dementia and individual programming that's focused on supporting the ADLs of individuals with dementia. Those facilities may also, with the dementia care, may also have a secure unit. That's not necessarily the case in every situation. So you can see kind of just the differences between those different licensures. Next slide. So that dementia care, we're not going to go into what the definitions here, but dementia care obviously can mean an ongoing care for somebody, including planned group and individual programming. And it does require them to have dementia-trained staff, so individuals who complete the minimum training required under state law and have knowledge and ability about how to support those with dementia. Next slide. So another option is adult foster care. Adult foster care is a very home-like setting. When you live in adult foster care, it's like living in a home. So it's 1 to 5 adults with disabilities or seniors living together in a house, each with their own bedroom. The living room, bathrooms, kitchen, other rooms are shared. A caregiver also lives in the house, which could be located anywhere, could be in a town, could be in a suburban neighborhood, could be rural. When you live in adult foster care, you get to choose the services that you want, and you can ask the caregiver for help with things like cooking, cleaning, laundry, help out on outings, personal care assistance services, etc. Next slide. Next slide, please. All right. Another option is board and lodging. Board and lodging facilities can vary in size with 5 or more people living together. Some board and lodgings are small homes, other are larger buildings. These offer sleeping spaces and 3 meals a day. The meals are served congregately in a shared location. Bedrooms might be individual or shared depending on the facility. And others, they may have other congregate spaces such as living rooms, dining rooms, cafeterias are shared. And they may offer other services like cleaning, laundry, help during outings, and personal care assistance. Next slide. So another option, as somebody may need some additional assistance, is skilled nursing. Skilled nursing provides 24-hour nursing care along with skilled medical management of specific conditions. Somebody might be there for a long-term stay, or they may be there for short-term rehab. And skilled nursing facility services include, obviously, skilled nursing, medication management, meals, housekeeping, laundry and personal care assistance, as well as bathing, dressing, and toileting. Those skilled nursing facilities are licensed by the state. They are long-term care facilities where people who need 24-hour nursing care can reside. To move into a skilled nursing facility, you have to go through a pre-admission screening to determine that you require that level of care. And that assessment is to review the individual's needs and supports. And that screening process is designed to make sure that someone who is not necessarily need that level of care, that they could look at other options in the community. Next slide. And lastly, I wanted to touch on some of the emergency housing resources. We have seen statewide, we have seen an uptick in the number of older adults who are facing housing insecurity or homelessness. And we just want to make sure that folks are aware of what different resources are out there for individuals who might be in that situation. In our region, older adults who are facing housing emergencies can connect with resources. Obviously by contacting Senior Linkage Line to get some assistance, but otherwise through 211 and the coordinated entry system. Individuals can get a housing screening and be connected with case managers who can assess their needs and help them find safe and affordable housing. And the coordinated entry system streamlines the process by really matching people with housing programs that best fit their situation. It also allows the system to be able to prioritize those who have the highest needs and ensure that older adults receive the supports that they might need to secure stable housing. And I am going to hand it over to Marjorie.
And let's just go back one slide, please, Ashley. Failed to mention and put in this slide, but we will get that resource to you, the MACV, which is the Minnesota Assistance Council for Veterans. So their main reason for existence is to end veteran homelessness in Minnesota. So people who are at risk or already homeless who are a veteran, that would be also a great resource. All right, now we can move on. So we're just going to go over now some of the costs and how we might pay for those things. This is a scary depiction here of potential costs, and it's a moment in time or a snippet in time of 2023 for Duluth. It may seem a little high on some of these things, and it may be because, for instance, the homemaker services and home health aides, it depends obviously on how many days and hours you're going to have an agency coming in and providing some sort of support. We didn't have a dollar amount there on adult day services, but on average in Duluth, it's about $70 per day. And there are some things that can help pay for like adult day services. Sometimes it can be covered, some of it under a person's health insurance like Medicare Advantage plan, also veterans care, things like that. So, but these again are just a depiction of the average cost of care. They took the annual rate for Duluth in 2023 and divided it by 12. Again, it may seem high, but this is just to show that if people were paying for these types of services or care settings, that's what they might expect to pay. Could be much lower, could be higher. Next slide. So the first method of payment we might look at is private pay, which means we or you cover the costs all on your own. Could be also being paid for by family members, but could be a different mix, but it all adds up to private pay. So people with moderate or higher incomes generally are going to be saddled with paying for the care themselves. They could maybe set up a trust, something like that, use savings. But it's, yeah, their own income basically. So the next slide is an option which is a long-term care insurance. Long-term care insurance isn't for everyone, but it's something that everybody should at least consider and either decide to do it, decide not to do it, rule it out due to lower income, things like that. But and then the policies for long-term care can vary greatly, but again, it's something that we should look at. It can provide in-home care, it can provide facility care, it can provide some dementia and Alzheimer's care. A person can write up a policy for a certain dollar amount or a number of years, whichever comes first. The policies offer inflation protection, things like that. So it's something, again, that a person could look at depending on what their income and assets are and whether or not that makes sense. I've talked with people before in rural Minnesota who said that their goal and their intent was to stay in their home And so they're wondering about long-term care. And in those examples, and again, I can't tell someone what to do, but if you know that you're planning to stay at home, and if you're in a real rural part of the state and you're expecting to bring cares in the home, they might not be available where you live. So is that really a good option for you if you know that that's your goal? I'm going to stay at home. You might be looking for other things to do rather than paying for a long-term care insurance policy. And again, we're not here to tell you what to do, but just to kind of tell you what your options are and what things you might think about when shopping around or considering long-term care insurance. Next slide. So some other considerations with long-term care insurance is that there are some tax benefits to it at tax time. And again, really a person should largely go to their financial planner or advisor to discuss some of these things, as well as the long-term care insurance policy that they're looking at. Um, Another thing you could do in shopping, there is a nice shopper's guide out there that's put out through the National Alliance of Insurance Companies, and it's not selling anything, so it's just things to look at. So that's just another good tool that people may choose to do if they're really considering these. Typically, the earlier you get into them, the lower you're going to pay, but also potentially the longer you're going to pay for them. But you're going to lock in at a lower rate, certainly for some of these policies. Um, so it's important to ask when shopping about that inflation protection and what all it will cover. And by what all it will cover, some of the things I would be asking for myself is how much of the policy covers in-home care versus skilled care in a facility. All those things can change and vary from policy to policy. So yeah, things to look at. Next slide. Um, yeah, not all insurances are authorized to sell in Minnesota, and I will say that any that are going to be overseen or watchdogged or by the Department of Commerce here in Minnesota. And that's with all of our health insurances too. So we can look at these partnership policies, which is something a little different. Not every company is going to offer them, but what it does is allows people to protect assets, so legally protect assets. So they can write the policy for the example there is $100,000. Maybe it's a cabin. I want to protect this property, this piece of company to have this legacy to leave my family. You can legally do that when going into a partnership policy and writing it for the amount that you want to protect. So that's something too that these insurance companies can offer and do. And again, not all of them offer partnership policies, but protecting assets is really attractive to some people and appealing. Certainly would be to me. So when they spend down all their assets and go on medical assistance down the road, that's the whole idea of it. You go on medical assistance down the road, you can still protect this big chunk of money or this piece of land or this property um, through having this partnership policy. Um, these policies, I should mention too, don't always work in all states, so that people should also consider whether they're going to move down the line, because reciprocity, it would be an issue for some policies, whether or not they move from one state to another. So again, that was long-term care insurance is just one of those options. And then we'll move on to the next slide. So just a myriad of other things that somebody might look at to pay for their long-term care. So trusts, which I mentioned earlier, which is basically private pay, but it's just something more formally set up where you've got somebody overseeing this trust for you and paying your bills for you with your money. You could sell your home or property. That would be one way to pay for your long-term care insurance. Life insurance policies can often be liquidated to pay for long-term care. There's accelerated death benefits, viatical settlements, life settlements, annuities. And again, those are usually things that you would be talking to with your financial planner or advisor. Um, we can take you so far on some of this stuff, but it's something that most people, if they've got, a nest egg, a considerable nest egg, they've probably also got a planner or an advisor that they're working with to discuss some of these things and how to use some of these monies. Um, and then also how to not looking for loopholes or anything like that, but also how to do things legally. It's a really important when you're moving money around and wanting to leave legacies and money towards family and things like that, that you do it in a manner that's not going to hurt you down the road should you spend down to medical assistance or something like that. But yeah, so lots of things. Reverse mortgages, not for everyone, but it's certainly another option that you could look at to have more money in your pocket to pay for long-term care or other things. Um, Health savings accounts can be used for that. Yeah. Next slide. And then the next one would be actually spending down to medical assistance. It's an option. It does happen for people. Obviously, doesn't happen with everybody or the majority of people, but it can pay for our long-term care and long-term care settings. It will be a little bit more rigid and limited when you go on medical assistance because you can't make all the decisions about where and when. Basically, the medical assistance is kind of going to dictate that at that point. So that's another thing. If you do have the means, looking at some of these other things will give you more freedom in your choices. Um, should those things exist, where you live, where you're choosing to live and spend the rest of your time. Next slide. So this is just a graph of some waivered services, and there's some slides coming up after this that are going to talk about these. But basically, this is just in a nutshell giving you the basics of how you would qualify for some of these things. So like with an elderly waiver, you'd have to be eligible for medical assistance. But with the alternative care programs and essential community support programs, you do not necessarily need to qualify for medical assistance to be eligible for these programs. What you do need to do is not need like 24/7 care, because then you've probably tipped the scales and the balance now is in favor of a person moving into skilled care facility if their care in home is going to exceed the cost of a skilled care facility. So those are some of those things. And the next slides again are going to kind of go through those and basically say the same thing, a little bit more detail. So next slide will just hone in on elderly waiver a little bit more, but it basically says what the last slide said. So I think I'll just move on because it's on that last slide. And then what elderly waiver will cover differs slightly from what alternative care covers and essential community supports. So when you move to the next couple of slides, you might see some of those differences. So alternative care might not cover quite the same number of things, might be like 4 fewer things than elderly waiver covers. And again, it's largely because of the setting and some other factors, but so the next slide will show some of the things that alternative care covers. And again, it probably doesn't show extended home care services, individual community living supports, which elderly waiver did, transitional services, which elderly waiver did, but largely it does cover the same, almost the same things that elderly waiver does. It's just that the person doesn't need to meet the criteria of being eligible for full medical assistance. We are trying to keep people obviously in the settings of their choice for a lower dollar rate, making everybody happy. Next slide. And again, same with the essential community supports. Don't have to be eligible for medical assistance, is 65 years of age or older, but some of the other things are the same, but then one it will cover, and that's on the next slide, will be slightly different again than elderly waiver and alternative care. So housing support, formerly known as group residential housing or GRH, is a state-funded income supplemental program that helps pay for the room and board costs to low-income adults who are at risk of institutional placement or homelessness. So, and who are residing in a licensed or registered setting for which County Human Services Agency has negotiated a monthly rate. So it must be contracted through County Social Services. In order to be eligible for this type of housing support, a person must have the county approval for the residence. So the resident agency or home must meet some criteria that the county has set or that the state has set for that. And the person must be older adult, blind, over 18, and disabled, and meet specific income and asset guidelines. And again, this is again trying to prevent the homelessness piece. So the criteria will be different, and the counties for all of these programs know what the criteria is and can help look through a person's application and direct them to the right path or the right um, program based on their needs and their income and assets and things like that where they live. So yeah, again, this is provided in kind of an adult foster care setting or community residential setting, board and lodging establishments, supervised living facilities, non-certified board care homes, and various forms of assisted livings. And again, each county will kind of have a good handle on what they have available to their residents in their county. Um, so people who are in these settings are usually considered to be living in the community or in their own home. So that's kind of a cool thing too. There's a little more freedom that comes with that. So they can receive some services from most community resources because it's considered a community setting or a home setting, such as home care and home health care and waivered programs. Next slide. Now we're going to run into energy assistance program, which is important because again, if you're eligible for one of these programs where you live, it's going to help put more money in your pocket to pay for other things and hopefully keep you independent, safe, you know, in your home setting. So it's going to be based on income. Some of these programs run out of funds pretty early on, especially, you know, in our nice Minnesota winters. Um, but yeah, they can connect to these programs in their counties, and people can call Senior Linkage Line, and that service can connect to these services as well and help with applications if there's questions about that. I know a lot of people have trouble finding support documents for a lot of the applications for things that are through counties or services in their community. And, you know, we can't necessarily come in the home and help you find those documents, but we can talk you through some of that. The next slide is just a reminder about the cold weather rule. That's active and valid every year from October 1st through April 30th. So basically telling people that they, you know, if they rent or um, and they're eligible for these things that they can create or put somebody on a plan basically to ensure that they can keep the utilities on and any natural gas or electric utility companies have to follow the protection rules of the cold weather. So that's good to know. So if you're ever in contact with somebody who's running into issues with that, it might be really good to um, have a copy of what the rule is to make sure that folks are protected. And the number there is at the very bottom of the slide and the website if you need more information about that. And I think Brenda's going to go into a couple slides with Title III.
Yeah, so I wanted to kind of touch on, I talked a little bit about it earlier about some of those organizations throughout our region that are providing programs, support programs for older adults. And a lot of that, they do go out and get grant funding and things like that, but many of them are also Title III programs, which means they receive money from the federal government, from the Older Americans Act, and that comes down to the state of Minnesota and then out through our agency out to those providers in the region. And that is done through a competitive process. And those types of services can be things like supportive services. It can be the congregate dining and home delivered meals, Meals on Wheels in our region. It could be things like disease prevention and health promotion programs. And it can also include things like family caregiver support. Just to get a little bit further into that Title IIIB, those supportive services, those are available to anyone over the age of 60. Those services are available on a cost share basis using a sliding fee scale. You cannot be denied due to an inability to pay. And those include things like chore services, so in the house, that might be helping with laundry or something like that, or just helping picking up. But outside, that could be things like snow removal, that could be leaf removal, that could be some additional garden work in the yard and things like that. Can also be homemaker services, including grocery delivery, assisted transportation, through a lot of our volunteer driver programs, transportation, consultation, self-directed services, legal assistance through our partner in the region, Justice North, legal education, technology, telephone assistance and home visiting, and then information and assistance through with Marjorie and her staff at the Senior Linkage Line. And if you can just go to the next slide, just to give you an idea of all of the folks that are out around our region who are out in each county providing services. We also have partners who are providing services to the entire region, like AEOA, which does the congregate dining and Meals on Wheels, Justice North, who provides services throughout the region in terms of legal services. But really, and Lighthouse Center for Vital Living, who provides services with assistive technology and other services. And so you can see wherever you live in the region, there's someone in your backyard, an organization that is providing those services to older adults in the community. And I will say that much of these services are provided by volunteers. And so if you are ever looking for an opportunity to help and contribute to the community, all of those organizations accept volunteers in their volunteer driver programs or home visiting programs or grocery delivery programs. And it can really be an impactful way to make a difference in your community and in someone's life. So, I mean, we're going to move on to, I'm going to hand it back to Marjorie and talk a little bit about the planning ahead. Marjorie, did you get a second to have a breath before we get back into this?
Yeah, I'm good. So, yeah, next slide, Ashley, please. Just to touch on all of the resources and tools that are out there. Own Your Future is an excellent website. I mean, you can really do a deep dive on this website. It's rich with information, and just wanted to say some of the things that you can find on this website is that 70%, and earlier I was talking about how on one of the slides, you know, that most people take care of themselves and aren't in the facilities. But I wanted to mention that 70% of people age 65 or older will need long-term care at some point in their lives. It doesn't mean that it could be after a rehab stay or after an injury, things like that, and going into rehab. But that's a lot of people, right? And then the other fun, maybe not so fun fact is that 40% of all persons receiving long-term care are under age 65. So that's also, you know, and again, what's the highest fall state? I think we're number one or two, and we're kind of always there. We have the highest falls, and I suppose that has something to do with winter, but that's where a lot of this happens is a fall, a broken hip, something where you're just having to do some transitional care. So yeah, that's out there. But anyway, back to this site, it's got some great things. And one of the things are, I mean, it's not all inclusive, it doesn't work, but they've kind of got it figured out to a science that they've got these checklists, and you can go to the next couple of slides that are just for different ages, like under 40, what should we be thinking about? And then what do we think about if we're 40 to age 60? What, and that's the next slide. And then the next slide is like, what do we think about if we're age 60 and retired? What do we think about at that age and not retired? So there's just different questions that we need to ask ourselves for, you know, to consider what we're going to do, what's our plan. And again, all of these checklists are located on this Own Your Future website. There's a little video, short video that you can play on that website as well, but it's a great website. Other resources, next slide, we have, and the next slide is some of the things here. I know we mentioned a couple things that maybe aren't on this page today, but we'll make sure, like MACV was one of them. Also want to kind of shout out, speaking of veterans, is that we have 8 veterans homes in Minnesota, so that might be very helpful to know for families and people who have a veteran that they're looking to place and can no longer keep it in the community. So next slide, just a little shout out for our direct support side, which is the Senior Linkage Line, and some of the things we can connect to or help with. So one of the big things obviously is Medicare that we're known for, but we do so much more with connections and with helping write community support plans to help people stay at home and or help return home from a transitional stay in in the skilled nursing facility. So that's really shortly. And then the next slide just shows a few more of those tools and things that you can find here in our area. There's the Own Your Future companion guide to the Own Your Future website, the Planning Ahead guide, which is super hot, hot, hot. It's at the printer again because we're out. So the state is getting those printed up so we can get more out there to people. And it just really simply talks about some of the things, again, that you should think about and things that anyone over 18 should think about by putting an advanced healthcare directive in place, powers of attorney, if that applies, estate planning, things like that. So if in doubt, you can always contact the live line, the 800 number, 800-333-2433, if you're looking for a long-term care shopper's guide or looking to access some tool or some material for you or your loved ones, just give us a call. And now we're just going to run into a little bit of time for questions. Any questions?
There is one in the chat. What do you know about NORC, Naturally Occurring Retirement Community? It's very extensively used in New York State and seems like it would be a good fit for Minnesota.
Well, yeah, you stumped
You,
me a little bit here.
they are they happen a lot more when folks are moving into an area. I think we just don't have as much turnover necessarily. If we've got people who are in single family homes, we do certainly have senior housing throughout the region where you have the ability to have services brought in and things like that. And it's like a lot of times coordinated through one of our local partners and things like that. But they're not officially in the naturally occurring retirement community.
If anybody else has a question, feel free to come off mute or put them in the chat. All right, if not, I want to just thank Brenda and Marjorie for their presentation today. It was a lot of great information. And I want to thank everyone for attending. We do have upcoming webinars. January 15th will be on age-friendly businesses. We'll have a little bit of an overview for how businesses can participate in our full age-friendly business training. And then also in February, we have a webinar on long-term care options. And on how you can connect with us. I know Marjorie's putting some links in the chat as well, but I will make sure that I send out all these resources in the follow-up email along with a link to the recording. And if you have any further questions, feel free to reach out to Brenda or I.
Say, Ashley,
Yeah.
we just had one other question in the chat, and maybe
Oh, yeah.
I can kind of field this, but I think Marjorie's probably better at it, asking about when people typically purchase long-term care insurance.
Yeah, it really varies. We worked with a fellow that was in his late 70s and had the ability to pay, but he was paying $700 a month or more at that point. So the younger, typically the better. And as I mentioned earlier, for most people, the earlier you start, the less you pay a month. However, the longer you might pay for it. So it might just add up either way, right? But some people wait out their ability to pay by trying to do that in their 70s or whatever. It might not be affordable anymore. And depending on what they are looking for, because you have to meet needing help with 3 of the activities of daily living for that policy to kick in. Another thing a lot of people don't realize about those policies is they don't kick in right away when you write them. You can write them for, none of them immediately start. So let's say you're in the nursing home today and you need help, or you need help in the home. A lot of them have a wait period of 30, 60, or 90 days. So those are all things to consider too down the road when you want to employ the plan and policy benefits.
Great. Well, thank you again, everyone. And thank you, Marjorie and Brenda. And again, if you guys have any follow-up questions, feel free to email Brenda or myself, and we'll make sure that we get you the. So have a great rest of your day, everyone.